With public employee pensions capturing the headlines in recent municipal bankruptcies in Stockton and San Bernardino, few are aware that the state's greatest long-term liability is not public employee pensions, but public employee retiree health benefits. While state employees were promised this benefit over the years in lieu of higher wages, the state set almost no money aside to pay for it, instead opting to take a pay-as-you-go approach. Now, as the costs begin to mount, there are some who are beginning to wonder whether the state can afford to keep its promise of providing retiree health insurance to its former employees. How big is the problem? What is Governor Brown proposing to do to deal with it? And will this issue ultimately be decided in bankruptcy court or at the bargaining table? We'll talk to Nick Schroeder, an expert on state employee retiree benefits with the Nonpartisan Legislative Analyst Office, and John Ortiz, who writes the Sacramento Bee's State Worker blog and is one of the state capitol's most authoritative reporters on public employee issues. Public employee retiree health care, a promise made to be broken?
Additional funding for the Maddy Report made possible by a grant from Paramount Agricultural Companies, growing healthy food for you and your family.
From the California Channel at the State Capitol and the Maddy Institute, it's the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Recently, the Nonpartisan Legislative Analyst Office warned that the state's most significant long-term liability is what it owes for state employee retiree health benefits. Our guest, Nick Schroeder, is the LAO's expert on state employee issues and here to explain some of the essentials of the state employee retirement health benefits, what it means for state workers, what it means for the state budget. Welcome, Nick.
Thank you.
So, can you briefly explain how health benefits are currently provided to retired state workers? How does it work?
Sure. So the state provides both active and retired state employees' health benefits. And the health plans that are available to active and retired state employees are the same plans, and they're administered by CalPERS. And the only difference between active and retiree health care is the amount of money that the state spends towards their premium costs. For a typical active employee, the state pays about 80% of the premium costs. But for the typical retiree, the state will spend 100% of the average premium cost. So in dollar...
A lot of running to the doors to retire to get the 100% benefit.
So in dollar sense, for the active employee, it's about $1,000 a month. That is typical for the state's contribution. That's assuming that it's a employee and one dependent. That could be either a spouse or a child.
So it's even more expensive for retirees.
Yeah, for retirees, it's about $1,200 a month.
Okay, so is this a promised benefit that's guaranteed for life?
That's really, there's some ambiguity as to whether or not it's a guaranteed benefit or not. It's something that the courts really need to decide how this benefit is constructed under federal and state contract law.
Okay, so it's up to the courts, I guess. So there are some people that do think it is a guaranteed for life benefit. Other people say it's just like any other contract that could possibly be.
Yeah, we're not certain. We think that it's still unresolved.
Okay.
The one thing that is certain is that there is no guarantee for future employees. So the state could change the benefit or even eliminate.
So you could have two employees working, one with the benefit and one that doesn't have the benefit. Yeah.
Depending on date of hire.
Right.
Yeah.
Okay, so retiree medical health care costs. I'm just wondering, what's the likely trajectory if nothing is done?
So since we're doing a pay-as-you-go model right now, the costs really are just dependent on health premium costs and the number of retirees that are receiving the benefit. And so over the past 15 years, the state's costs have nearly tripled. And that's because of health premiums growing, and that's really just a national trend of health costs growing. And then also the number of retirees has increased, and that's because people are living longer for the most part.
And also the baby boom generation is kind of moving through the workforce as well. So we're talking about the pay-as-you-go system. Has any money, though, been set aside to pay these benefits long-term? And what is the actuarial calculation of the outstanding liability?
So virtually no money has been set aside.
You said virtually, which means probably a little bit.
There's less, by the end of the next fiscal year, there's estimated to be less than $200 million saved up. And that's because the state has started pre-funding for 3 bargaining units. And the unfunded liability by the SCO's calculation is about $72 billion.
So 200 million sounds like a lot, but when you compare it to 72 billion.
Right, it's very small. Virtually nothing's been set aside.
Yeah, it's hard to refer to 200 million as chump change, but in this issue it kind of is. So we've got this current pay-as-you-go system, and there's also something called a pre-funding model. Could you explain the difference? What are the advantages and disadvantages of each?
Yeah, sure. So to explain this, I'd like to use an example of a hypothetical employee, John. So let's say he's worked for the state for 20 years, and he's retiring in the 21st year. So each of those 20 years, the state has promised that they're going to provide him health benefits for both he and his wife in retirement. Over those 20 years, the state hasn't put any money aside to pay for that benefit. Instead, the state's going to pay for that cost after he's actually retired, and the state will have to find about $14,000 to pay those benefits. Under a pre-funding, what would happen is that in those 20 years, each year the state would put money aside, and it would be invested in a trust fund. And after he retires in the 21st year, the money in the trust fund would be used to pay that benefit. And so the state's costs after he retires would only increase if there was a shortfall in that trust fund.
And typically they use that method for pensions.
Right.
And that pays a large share of the pension cost, correct?
Yeah, so if you look at the CalPERS model for pensions, about 2/3 of the benefit payment is actually from investment gains.
So this is very much a pay me now or pay me later, but it's going to be less expensive long term if you pay me now because you can use then the interest on that money to pay off the obligation in the future. Is that basically how it works?
Yeah, that's exactly right.
And you also mentioned that the cost, because they're using this pay-as-you-go system right now, has tripled. And my recollection of reading some of your work is it's was about $500 million?
Yeah, it was about $500 million, and it's now, well, in the next year, it's going to be about $2 billion for retiree health benefits.
Yeah, so that's quite a jump. What I was reading was $500 million to $1.5 billion, but a few hundred million here or there. It's big numbers.
Yeah.
So what is it going to cost to address the current unfunded liability over 30 years if we're trying to retire that debt?
So based on the same SCO actuarial report that the $72 billion
And SCO stands for?
The State Controller's Office.
Okay.
So each year they produce an actuarial valuation that looks at this. And according to that report, if we were to start paying, so we'd start pre-funding benefits that employees earn each year, and also to start retiring the unfunded liability, we'd have to put away $4 billion in 2015-16.
Okay. Well, thank you very much for that overview on the cost of health benefits for retired state workers. Up next, what is the governor proposing to address this liability over the long term? That conversation in a moment. This is the Maddy Report. Welcome. What are Governor Brown's proposals to address the state's projected $72 billion unfunded liability for state employee retiree health care? Our guest is Nick Schroeder, the retirement benefit expert at the nonpartisan LAO's office. So there appear to be two elements to the governor's proposal. The first concerns how to fund retiree health benefits. What's the governor proposing?
So within that part of the proposal, there's really two pieces. One is what to do with the existing unfunded liabilities. So that's the benefits that have been earned to date by current employees and retirees. And the second piece is what to do for pre-funding the benefits that are earned in the future. So for the existing liability, the governor proposes continuing this pay-as-you-go process for about the next 30 years until it's paid off. And so that would be, we're going to be paying $2 billion in this next budget year. And at the end of the 30-year period, it would be about a $7 billion payment for
and
that
let's
part.
put that in context. I mean, how big is the state budget?
It's about $100 billion.
$100 billion? Yeah. So 2 to 7% of the state budget just going for this one issue, just to be clear about it.
Yes.
Yeah, that's a lot of money. And so there's also this pre-funding.
Right. So for pre-funding, what the governor proposes is phasing it in through collective bargaining so that employees and the state each pay half of what's called the normal cost. And that's the amount of money that needs to be set aside each year to pre-fund the benefit that's earned.
So normal cost is that's my benefit right now. I'm going to pay for it going forward. It's not the accrued liability from years past.
Right. It's looking forward. It's the amount that needs to be set aside to pay the benefit that you're earning today.
And they're going to do this through collective bargaining, which means they're going to sit at the table and negotiate.
Right.
And at least my understanding of negotiations is I'm not going to give you something for nothing. And so if the employees already have retiree health benefits and the governor and the state wants them to give it up, what's going to happen there?
Well, if there's a offsetting increase in their compensation of even $1 or 75 cents, the state's costs to share this benefit would actually be more expensive than if the state just paid the normal cost
Okay, so
completely.
explain that to our folks. So,
Sure.
So I say, okay, fine, I'm not going to have retiree health care anymore. It's going to be different, less of an amount. So I want higher wages. I want my salary to go up to make up for that.
Yeah.
So why, it's just a one-for-one deal, right?
Right, so the $1 increase to your pay actually increases the state's cost by, on the average employee, by $1.30. And
Why is that?
And that's because we have to pay for your pension and your Medicare and Social Security, and these are all benefits that are salary-driven, which means that as your salary increases, the cost for that benefit also increases.
It's like a ripple effect.
Right.
Okay, so the second part of the governor's proposal is to change what health benefits future employees are going to get in retirement. How would he change that?
So he would reduce the benefit by making employees work 5 years longer, And so to be eligible for the benefit, the future employee would need to work for at least 15 years. And then to receive the maximum benefit, they would need to work for 25 years.
Okay, and the maximum benefit, as you were talking earlier, it was 100% for retired workers.
Right.
Would they keep it at 100% or would they drop it down
Right,
to 80?
so the governor's proposal would reduce it down to 80, which is more akin to what the typical employee would receive in active service.
Okay, so more years of service and a less of a benefit.
Right.
And this would be, I assume, for new employees.
Right, so it'd be employees first hired after January 2016.
Okay, so what is your assessment of the governor's proposal?
You know, we think that he identifies a very important problem. It's something that we've raised in the past. That being said, we think his proposal also raises a number of questions.
Okay.
And because of that, we think
But
that...
by the way, I'm sorry for interrupting
Sure.
you, but I want the folks to see this report that you did. I just want to plug it and just say, you know,
Sure.
the LAO does these reports on a regular basis, very valuable and informative. So if people want to learn more about it, they can read your report. Sorry for interrupting. So,
No, a plug is fine.
But I saw that, and I want to make sure our
Yeah.
folks knew about that. So what is your assessment, again, going back to the governor's proposal? You think there's some issues there?
Yes, we think it raises a number of questions that the legislature should consider. And so in the end, what we recommend is that the legislature's policy committees hold a series of hearings to discuss the governor's proposal and also any other proposals that might be out there to address this liability.
So what do you think the key questions the legislature should be considering?
You know, in the report, we raise a number of specific questions. The first question, it's kind of the threshold question, is what should this benefit look like going forward for future employees? And we're in an environment where employees are more likely to retire at a later age, closer to Medicare eligibility. And with the Affordable Care Act, they're also able to buy insurance on the exchange if they're not yet eligible for Medicare. So
very different than the way the system was when it was first set up.
Right, I mean, it was set up originally in 1961, so before Medicare was even a thing. So it's possible that future employees will value this benefit less than it costs the state. And if that's the case, then the state and the future employee might be better off offering some other type of compensation.
So the real question here is, do you need this benefit to recruit, retain, and motivate the existing workers? You're saying you may not.
You may not, or you may need to reduce it, or just change it. And that's really the first question that should be asked, because that really will determine the funding plan going forward.
Okay, well, I want to thank you for that overview on the governor's proposal to address the short and long-term costs of retiree health care benefits for state workers. Up next, the Sacramento's most knowledgeable observer on public employee issues, the Sacramento Bee's John Ortiz, explains the politics behind the issue. That conversation in a moment. This is the Maddy Report. Welcome back. We're now joined by John Ortiz, who writes the Sacramento Bee's State Worker blog, a must-read for those folks who want to know about what's going on with public employee issues in California. Welcome back to the Maddy Report.
Thanks for having me.
Well, the LAO seems to be suggesting that the legislature take some time to study this issue of public employee retiree plans. Some worry that that's just going to result in political cover to not really deal with the issue. Is this justified? Is a go-slow approach justified?
Well, I think two things can be true at once, right? Maybe it's a good idea to go slow on this. I mean, we're talking about an expense to the state on the order of about $2 billion a year, and that's only going to grow over time. We're talking about health care at a time when we're seeing gigantic changes nationally, right, with nationalized health care. So we don't know really what the future holds as far as that goes. And then on top of that, of course, it's politically sensitive. And the legislature, let's just say that sometimes they have to be led along slowly.
Yeah, I would think this is a very hot topic issue. My guess is when you write on this issue, there are a lot of public employees that respond.
Well, it's huge. I would say it's right up there with pensions, because when people join the state, they look at what the future holds. And retiree health is a huge component of that.
It's a trade-off. I mean, maybe a little less compensation, set straight salary, but I'm going to get a great pension at the end of this.
Right, and the retiree health is bundled right up with that.
Right. So the LAO has been suggesting that, maybe a good use of that Prop 2 rainy day fund money might be to retire or start to retire this major debt for state retiree health care. Any legislative appetite for using Prop 2 money to deal with this issue?
When I talk to people, what I get back is crickets. And the governor has, and understand, Jerry Brown is not a guy who likes to respond to hypotheticals, but this was one time when he said flat out, no, I don't think that's a good idea. I think his feeling is that voters approved Proposition 2 and perhaps would not have if they had understood that a big chunk of that money would go to pay down state retiree unfunded obligations on health care. The other point is that we're talking about if the state could write a check today and cover all of that, it'd be about $72 billion. So if you dip into
And the whole state budget, just put it in context, the whole state budget is?
About 150.
Right, so about half the state budget.
Yeah.
I think a lot of people listening just went, what?
Well, yeah, it's a good chunk of money. Of course, that's spread out over time, but the point is that you could dip into the rainy day fund. There's no guarantee that money would be there next year. It's not a fix. It would be a one-time spend, and I think it would blindside a lot of people, and the governor would have to stand up and justify signing off on that. I don't think he's prepared to do
one of the
that.
arguments, though, is that, listen, if we put that money aside now, we can start earning interest on it and kind of start to pay down that with interest, not just with the money, but with the interest on that money. But
Right.
Well, let me go on to another question. You know, the governor says, let's negotiate with the unions on this issue. What's the union's early reaction on this? Are they receptive to changes in retiree health?
Well, unions exist to negotiate like dogs exist to chew on bones. And so whenever
No, they would say they're there to represent their members.
That's true. And so the governor can't stand up and say, let's just ram this down the union's throats. I think he's sincere when he says he wants to bargain it. But that will entail trade-offs.
Right.
And the unions, I think, have already got a no-way list and a maybe-way list. And some of those trade-offs, I think, have very big ramifications legally and for decades to come. So, you know, there's a lot of talk about negotiation, but there could be some brakes put on that, too. The legislature, I think, wants to get involved.
Yeah, it's interesting. You know, in negotiations, you're typically not going to give something for nothing. You're going to
Right.
want something in return, and the question is that a good deal for the state? I guess we're going to find out. So you've written that CalPERS, which is dominated by union appointees and politicians with labor ties, has generally stayed away from offering the kind of low-premium, high-deductible health plan that the governor's been proposing. However, you note that CalPERS does offer a low-premium plan called PERS Select. What's been their experience with that? Do employees sign up? Do they like it?
I think that you could aptly rename that plan PERS Nobody Selects. 17,000 people, give or take, have bought that policy. They're covered by that plan. By comparison, nearly 1 million CalPERS members have HMO plans that cost a lot more out of pocket, but they provide, you know, certainty when you go to the doctor, when you go to the hospital, you're not going to get hit with a big bill, unlike the PERS Select plan. And I think what it reflects is that when you're talking about government employees, they value certainty. They value security. That's why pensions and retiree health are a big deal to them. So just because the governor offers a low deductible plan, he wants to pair it with a health savings account so that people could use that money to offset these higher costs when they go to the hospital, for example. I think it's very much in play as to whether folks would actually take that.
That's an interesting argument that you're making, or suggestion you're making about security and public employees and why they choose public employment to begin with. Well, anyway, when we come back, we're going to talk about the other big state employee retirement issue, public employee pensions. What's going on there? That conversation in a moment. This is the Maddy Report. Welcome back. We're talking with John Ortiz, who writes the Sacramento Bee's State Worker blog. So public employee pensions, are they getting better or worse? Of course, the answer to that question depends on who you're talking to, a public employee or a public employer. So one of the things that's happening was last year, State Controller John Chang indicated that CalPERS may not be adequately addressing the problem of employees spiking their last year's salary to get a higher pension. Has CalPERS done anything to address that issue?
Yeah, you know, that's an interesting question because it goes to the nature of what's effective and how government is supposed to oversee things. With spiking, of course, what you've got is a situation where an employee may, through hook or by crook, get higher salary toward the end of their employment, so that that number factors into the pension that they get for the rest of their life.
So typically, right, for a lot of public employees, it's the last year's high, or the highest year's salary is what their pension's based on. So you wait and wait and wait and wait until just before you're about to retire, get a big promotion or some kind of bonus, and
then you get that for 4 quarters, and bam, that's how your pension is figured. So CalPERS has about 3,000 employers in its system.
Wow.
It has about 30 auditors. And so what Chung said was when he ran the numbers, they were doing about 45 audits a year. And at that rate, it would take, half a century for them to get around to everybody in the system. They've since boosted that number to about 100 audits, but that would still take them, 30 years to get around to everybody. Now, CalPERS says, hold on, we pick high-value targets, kind of like, drones and the missile shots. We figure out who's most likely to spike, and that's where we go. But Chung says, look, there have been enough problems with this. The B and others have reported on cases that have gone on for many, many years with spiking and didn't get caught.
Another issue that came up last year was the CalPERS board voted 7-5 to count more than 100 kinds of supplemental and temporary pay toward calculating pensions. Governor Brown wasn't in favor of that, obviously. Has that decision been reversed or modified?
Well, the administration says they want to come back to it, and of course what we're talking about is extra pay that police get for marksmanship, or the kind of uniform pay, or various types of supplemental pays. Cement finisher pay.
Cement finisher pay?
Cement finisher pay
To look
is
that one
on
up.
that list. So the governor wants to come back to it. Here's the problem. The board is stacked against him. He has 5 appointees. There are 13 members on the board. Do the math.
He did. It was a 7-5 vote, so
that's
somebody didn't vote, but...
Yeah, the chairman doesn't vote.
Okay. So there you go. It's just a math situation.
That's
like,
right.
Like pensions, but in a different way.
Yeah.
So a lot of attention on this issue seems to be focused at the local level, where there are some Chapter 9 bankruptcies occurring with some cities, Stockton, San Bernardino being 2 of them. They're defending, giving CalPERS money. Their creditors say, no, you should pay us. Where's this going to be really resolved? Is it going to be resolved in the bankruptcy courts, or is it going to be resolved at the bargaining table?
My sense is that right now, the bankruptcy courts have fired that warning shot that says, look, if you really want to push this, the courts have decided that pensions are not bulletproof, that the, quote, California exception has exceptions. And so I think what that does then is it creates a different environment at the bargaining table, where you're going to see unions, particularly because of changes to pension law that have also made it more difficult to increase what employees get in their pensions. I think what you're going to see is more of a push toward better wages. And I think that some of the stuff we've been talking about with retiree health could factor into it.
I mean, it's almost pay me now or pay me later.
That's right. And I think for a long time, government has been we'll pay you later organization. That may change.
So anything you're hearing at the local level in terms of what's happening at cities and counties on this issue? Pre-funding, for example?
Yeah, there is some pre-funding going on. I think CalPERS recently reported that about 450 local municipalities have some money in a special fund. It's about $4 billion in a pre-funding account that they've set up. It's a drop in the bucket, but it's something.
$4 billion for a $74 billion liability. Okay, there's San Jose Mayor Chuck Reed and I believe San Diego
Carl DeMaio
are talking about a pension reform measure, possibly on the November ballot, probably 2016, I assume. That going to happen?
I doubt it, because it's hard to get somebody to write checks for that measure. We've seen it fail time and time and time again because nobody will step up and say, I'm willing to write $1 million to qualify this thing and another $10 million to fight labor when it actually gets on the ballot.
Typically, some of those labor propositions, when we've seen them in the past, they are extremely expensive on both sides. I mean, they both really go to war on those issues.
Yes.
And I'm assuming, given how important this is to public employees, same thing.
They're already baring their fangs. They're trying to scare everybody away. They have their PR machine cranked up. It's going to be tough to get this thing on the ballot.
Okay, well, I want to thank John Ortiz from the Sacramento Bee's State Worker blog and Nick Schroeder from the California Legislative Analyst Office for joining us. If you want to stay up to date on state and local politics, you can sign up for our free e-newsletter, The Maddy Daily, by logging on to our website at maddyinstitute.org. This is Mark Keppler for The Maddy Report. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the California Channel or the Maddy Institute. If you'd like to share your thoughts about the points and opinions expressed on the Maddy Report, visit our website at maddyinstitute.org.